Well, I was about 20 years old when it first broke out, so that came as a bit of a surprise, obviously. And the first year I spent pretty much in complete despair and thinking, this is just going to get worse and worse, and I'm going to die old and alone. But luckily, I mean, moving things forward a bit, I tried the metro Trexat. I still can't pronounce it, but it's horrible. It's I just had pretty much chronic nausea for like months and months and months. It did work, but I could do nothing except just hang around a toilet in case something had to come out. So I pretty much gave up on that pretty quickly. And I tried various different types of diets and vitamin supplements and exercise and God knows what, and nothing really seemed to help. And then I found out that my view on myself and my condition really had a huge effect on outbreaks, potential outbreaks. So in other words, stress levels were really important for me to be aware of, and in moments of very intense work or very intense emotional distress or anything like that, I would flare up. And if I got a chance to kind of get a grip on my situation or kind of accept wherever I was, it would also kind of calm down again. So that made me very aware that stress was my number one trigger. And yeah, I think I pretty much just focused on trying to find a way to make myself kind of relax and find a way to be at ease with having this disease. And after a couple of years, I got in touch with a friend of a friend who knew someone out at Leo, and said they had this program going, and asked if I wanted to be a part of that, and I said yes, and now we're here.
Wonderful. And before we get to that part, was your outbreak, your initial outbreak, was there something stress related as well that you could kind of tie into your
Looking
outbreak
back on it, no, I
well?
can't really find out what was the trigger for it. I mean, because actually at the time I had the outbreak, everything was kind of going pretty well. I mean, I had a job that I liked, and a girlfriend that I liked, and an apartment that I liked, and I mean, things were really going well. It just it started as a little piece of dry skin on my elbow, and I couldn't figure out what it was, and I tried, just general moisturizer or whatever. Just didn't really do anything. It just got slightly worse and slightly worse and slightly worse, and I waited, typical man, waited like a year before I did anything. No, it'll go away. It didn't. But I waited about a year until I actually went to a doctor and got it diagnosed with plaque psoriasis, and yeah, pretty much took it from there.
Yep. But I guess that is part of the challenge with the disease, that sometimes the effect from something is shows itself in a delayed manner. So
Yeah.
It could be that the event happened unknowingly sometime earlier, and
I've been looking back many times. I just really can't find out what triggered it in the first place. It just sort of happened.
and then of course that you actually could identify the stress and your perspective on it. That is already quite a good step that many other people living with psoriasis are still struggling with finding this coping mechanism.
As it's been mentioned already, I mean, it's very relative from person to person. I mean, very subjective. I mean, what worked for me might not work for anyone else, as far as I know. But it's really just been the most important factor for me. But I've learned that the hard way. I spent like 4 or 5 years trying pretty much everything else,
Right.
until I realized that my actual stress levels were by far more important than anything else.
And how do you consider stress? Because that is also a subjective concept, and for everyone,
Oh, yeah.
again, it's a difficult assessment maybe to also accept or realize. Okay, I am stressed. Did you have some aha moments there along the journey?
Well, I mean, I've grown up with a father who's always been very aware of what you would call like mindfulness or something these days, but he's very present, and he cares a lot about emotional and mental well-being. And from like from yay high, he's been talking to me about, how do you feel, and are you okay, or do you feel pressured, or do you have heart palpitations? So he's kind of trained me to be very aware of what's going on inside me, not on a biological level, but pretty much on anything else. So it's just always been a part of me to kind of be aware if I'm shaking, if I'm nervous, if I can't sleep, if I can't eat, and be aware that that's usually some kind of psychological factor that's
Right.
triggering the lack of something or an excess of something. So
and we talked a little bit previously when we talked about this session here, and even though you actually for us luckily, and I hope you also got something out of it, try to imagine your general kind of attitude or opinion about technology and digital solutions, especially in the mindfulness space, is actually maybe a bit more reserved, or I don't know what I want to call it, but there is a lot of apps that try to make you meditate and become more mindful, and we all know that it's heavily linked to chronic conditions and so as well psoriasis, but you actually have a slightly more critical take on it.
Well, yeah, but that's also partly because of my upbringing. That I don't necessarily find technology to be 100% positive. I mean, it can also rip people out of actually being aware and present, and in the moment, in your body, in the world you're living in, and if I, for instance, if I had to pay 200 crowns a year to get a meditation app that I would then need in order to meditate, in order to actually relax, then I'm not learning to relax. Then I'm depending on this app to let me relax. Then I'm not any better off. I'm just in the power of this app. So, I mean, apps can definitely teach you good stuff, or not apps, but technology. I mean, you can use it to share information and learn and grow. But if you don't actually absorb it and kind of make it part of yourself, then it's just it's a crutch, and it doesn't really cure anything. It's the symptom treatment of something that you're missing yourself. Like an ability to relax or whatever.
So when you got introduced to the Leonovation Lab through your friends, what were your initial thoughts?
Well, I mean, the Imagine project, you mean? Yeah. Well, no, I thought it was a very cool project, because at the time I was very aware that my stress was the main trigger, and but I didn't really have a very big oversight of just exactly how much difference there was between an almost non-existent condition and like a huge flare-up. In my head, there were vastly great distances apart, those two. But it turns out, using the Imagine app, where you can kind of follow the progress of your skin, on a daily basis and swipe through it, and it actually occurred to me that it doesn't really swing around that much. The difference between what I think is bad and what I think is reasonable is actually very minimal. And the app helped me realize that, and helped me realize also that it was actually definitely the stress that was the trigger. Because I could see, with dates and everything, that I've been eating healthy in this whole period, and I'm not feeling, stressed about. I'm not feeling like I haven't exercised enough or whatever. But if I had loads of work that week, for instance, I could see that the following week the flare-ups would come. So it really kind of confirmed my own suspicions for me that was my main trigger.
Maybe for those who don't know how the app works, could you explain a little bit how it works, how you used it?
You have to pick a spot somewhere on your body, and you pretty much just photo diary follow that spot on a daily, weekly, monthly basis, and then afterwards it's got a very nice kind of user interface where you can sit and kind of swipe through all the pictures and really kind of get a comparison really easily. And that can really help you realize, exactly, well, if you combine it with being aware of what you're doing on an everyday basis, because then you can say, oh, well, I've been eating horribly that week, or I've completely done zero exercise that week, or whatever it is that kind of works for you. But
so being able to kind of link those things together and maybe confirm or discard your assumptions that
but also just tie it up on more than just assumptions and memory, because that can be tricky. It's nice to have some actual photographic evidence of how it looked like a month ago when I remember it was really bad, but I look at it and go, it's not that bad actually.
How did that make you feel initially, that you remembered it differently than you actually could see it was?
Well, again, through my father, I'm pretty much aware that the mind plays tricks on you, and I try not to take myself too seriously. So whenever I have a memory of something, I think, oh my God, that's mortifying. I usually realize that it's probably not. It's probably just something I'm building it up to be, or making it up to be.
And you also at some point stopped using the app again, and I mean, and that's, I think, that is okay from our perspective, right? Because hopefully it brought you to a better point, or gave you a little insight that helped you along the way. But
Well,
what kind of realization then triggered you to say, okay, I'm done with this app for
Well,
now?
it's actually thanks to the app that I'm not using it anymore, if that makes any sense.
Yes.
But the app made me realize and confirmed for me that stress was really the main trigger, and that it wasn't as bad as I thought it was. So that's good. Apart from that, it just didn't seem necessary for me to keep documenting the same spot for months and months and months when I can see that there's not really any big difference. I mean, I get it now, you know. And after that, all the reminders of me having to take pictures just
Yep.
became another stress factor.
Yes. Yep.
So, you know, through the same method as I live every other aspect of my life, I just cut the app out because it became a stressful part of my everyday life.
And I think that's
Because it was always in bad timing. I was always like in the middle of work or something else, and I can't take pictures right now and have to remember later, and all of a sudden it became this big kind of thing breathing in my neck, and I just didn't like that, so I decided not to use it
And I
anymore.
think that's an important kind of
But that's-
message also for us and for anyone else developing digital health solutions, that even though we might know that the condition won't go away that easily, but people kind of are on different phases in their lives, and hopefully also the phases where you are on top and feel on top of it, and don't need to be reminded about it. That's something we hear again and again, that when you have some coping mechanisms, when you're doing relatively okay, you really want to disconnect from the condition.
Well, yeah, and
and
especially in my
forget about
case,
it, right? Yeah.
I mean, if stress is that much of a factor for me, then I have to listen to my stress
Yes,
levels and
yes.
so on. But if it was anything else, I probably wouldn't even be bothered by the fact that it
Right.
gave me a reminder here and there. So yeah, it's very relative again.
Have you any other kind of recommendations or suggestions to we're hearing also about other digital health solutions, but what should people, behind these apps keep in mind and pay attention towards?
Well, it's hard to say because it all depend on exactly which disease and which app we're talking about. But in general, I'm a big advocate of developers trying to make apps where the apps themselves work towards making themselves redundant. I mean, that they can inform or train or educate to a point where you don't need the app anymore, where you've actually made a better mind or a better body or a better whatever. I think that's the way forward, because if it becomes a bigger and bigger part of people's lives that you need all this technology in order to function, in order to survive, I don't see that as being very liable on like a 50 to 100 year basis. It's gonna be too much, and it's gonna consume all time and energy into registration and documenting and logging on, and it's just
And hopefully we can get to the point where technology can withdraw again as well.
Sure.
and maybe still stay vigilant in some way and be there for you when you need it, but otherwise kind of leave the empowerment to you to say, okay, now I don't need it anymore.
yeah.
And
Well,
this-
just like in Stina's case before, I mean, she can use all this DNA and all this science to learn about herself, and that's great. But when it then turns out that it's sunlight and salt water that really
Right.
does the trick, I mean, the combination of those two is brilliant, but she should also get to the point where she realizes that it's salt and sun that really does the trick, and then just go with that instead of, not saying that you do, but one could be tempted to kind of keep digging into the whole scientific research stuff, and I think you could possibly end up drowning in that instead of trying to find something that works for you and then just doing that. And again, it's very hard to speak so broadly about it because it's so subjective from person to person.
Yes, it is.
But as I see it, then we can use it, but if it being technology, but if it becomes too all-consuming, then technology just uses us.
Wonderful. I think yes. Thanks a lot
Sorry.
for sharing your thoughts. I think some very interesting points you made to reflect upon as people developing these technologies.
Thank you.
Thank you so much. So we heard already a little bit about Imagine and the app, and it's really about what Alex said about empowering people living with a condition, a skin condition such as psoriasis to, in the end, and that is a beautiful goal actually, to make the app itself redundant again, right? Because hopefully you help in some aspect those people to take a bit more control and get those insights to stay on top of the disease. So I'll just talk a little bit about skin diseases, psoriasis, and how we approach to developing this app, what it is, and a bit where we're going in the future with it. So just in general, there's 1 out of 3 people who will, in the course of their lives, develop some sort of skin issue. So that is affecting actually quite many people. But if we're looking at, for example, Denmark, there's around 100 dermatologists, so those specialized on treating skin conditions for 5.7 million people living in Denmark. So that's very few specialists. And you can see it when you go to the public portal sundhed.dk, which is, I think, great that Denmark actually has all this data available. But and you can see the waiting times, and as already mentioned, in some cases they are really long, right? 20 weeks. So we also, with a sister project of the Leo Innovation Lab, got into quantifying, okay, what are the effects of such a chronic skin disease to live with it? And they are quite big. And of course, there are a multitude of factors affecting it, but you can see that in general, Denmark, compared to a bunch of other countries, is doing still well in terms of the happiness level, also of those people living with psoriasis. But if you look at the relative difference, and Denmark is of course also the happiest nation in the world, but then people with mild and moderate and severe psoriasis, they have a lower level of happiness, and this is what we call the happiness gap. And here in the case of moderate psoriasis, it's 25%. Where those people are less happy in their lives. And that has, of course, huge consequences on society, on economy, etc. So one of the challenges with a chronic skin condition and disease such as psoriasis is that we heard it's highly individual. There are many factors influencing it. It can be difficult to identify the triggers. And unfortunately, research hasn't really gotten there yet, where we can pinpoint it for every individual and say it is this, it is that, you should avoid this, you should do this instead. And so when you're looking at your skin day to day and you're wondering, is it getting any better or worse, it can also be difficult to see the changes. And as Alex said, your mind plays tricks on you, right? So you might remember things in a different light. And I think if you ask about a person, hey, could you link the weather to you? It's not that easy. You won't even remember how the weather was last Wednesday, probably. If you look at classical innovation theory, Eric von Hippel has a term that is called the lead user. So you could ask, okay, what are the lead users living with psoriasis? What are those people trying to do about it, faced with the challenge? And you can find a movement that's called of the quantified self, where people take a lot of effort to in the end, track and self-experiment and track the effects with it, and that's of course a lot of effort that most people won't be willing and have the right tools to do. So with that in mind, the project called Imagine was born at the Leo Innovation Lab, and it went through our innovation process, which is quite tough, and a lot of ideas get killed before they get started, or when the project is live, as we find out it's not working as it should. I think a key element in here is that from the very start it was very heavily focused on involving patients, but actually we should probably all remind ourselves not to talk about patients all the time. It's just people, right? It's people. There is also no users of the app. It's just people using the technology, of course. But to heavily work together, and we have anthropologists supporting us here. We have, of course, the designers and the developers, which can give a fantastic insights and feedback mechanism onto the development. The app has been live for a while, and it looks a bit like this. Alex described it. So you pick your areas on the body you want to track. We use some computer vision technology to help you find the right spot again to take easily comparable photos, and you can also track other things like the discomfort level, for example, and then correlate those things. From the start, there has been a slightly bigger ambition and idea, and that's because this app, as you can see, is seemingly simple. There is a lot of hard work and effort into it to make it really work, but it doesn't. Yeah. For the long term, what the ambition level from the start was to provide, of course, more automated feedback in terms of, hey, is my treatment working as it should? Is the diet I might be trying, is it actually getting better? And we knew for this we would need a lot of data. So actually, people using the app, they're contributing with their data, and we're using the identified data to really train what you would call machine learning models, deep learning models, AI in the broader sense. So if you look at these 4 pictures, each of them depicts a disease where in recent years, really only the last 2 years, deep learning, so image recognition-based machine learning technologies have shown that they can perform at par or even above the level of human experts. So that goes for skin cancer, and we will hear a bit more about that, for stroke detection, for retinopathy in the eye, and also for nail fungus. Skin disease is especially a hard one to work with, because there's over 2,000 roughly in the world, and as you can see here, in some of the cases, they really look alike. But one treatment for one disease might have bad effects if it's actually the different disease. So with that in mind, we have been training our AI models to start with detecting psoriasis and eczema. Actually, those two can often resemble each other, and the triggers may be very different, so it's important to distinguish between the two. We have been lucky enough that people seem to be very willing to contribute with their data when they can see that this is serving a bigger goal and a purpose where we expect to also deliver something back that is more than just the tracking aspect. And right now with these models, we reach an accuracy of 91% with a sensitivity and specificity also in those levels, and that is matching what we see human experts do when they look at photos and have to say, well, this is psoriasis or it's not. And we're getting there with other diseases as well, as we continuously try to expand that. So in the end, really our vision and ambition is that we want to empower people to find those insights and then maybe get rid of the technology again. We want to help the healthcare professionals as well to as an ordinary almindelig lay, a general practitioner, where your main focus is probably not skin. There are 2 or 3 health areas that might be more important for you to focus on, but skin is playing a vital role. So to help you kind of be better at diagnosing and work together with the dermatologists here. And ultimately, hopefully, as John also alluded to, using all these insights to say, do this here, and you might actually be able to prevent an outbreak. So thanks a lot for listening today, and ready to take any questions if there are.